right, so just continuing on talking about other eating disorders that can occur. All right, now diagnosing, moving into our binge eating. So if we look at the DMS-5, recurrent binge eating is categorized, again, same as what we've seen with bulimia. So eating large amounts of food in a short time or experience that loss of control over eating. Now, again, the purging isn't part of this. So these episodes of binge eating are associated with at least 3 of the following. So rapid rate of eating, so eating very, very quickly, continuing eating beyond feeling full, eating, especially overeating, even whenever they weren't hungry to begin with, eating alone to avoid embarrassment, feelings of self-disgust, depression, or guilt from that. So again, having 3 of those is part of the characterization. Again, extreme distress about the binge eating. Those episodes occur at least once a week for 3 months. So again, consecutive or consistent use, and behaviors, though, are distinct from bulimia or anorexia. So some of the common behaviors, now this is different from bulimia because there are no compensatory behaviors. So they're just binging, they're not purging. However, they're isolating themselves due to the large amount of foods that they're eating. They use foods to reduce stress, providing a feeling of power or well-being. Typically, junk food is what is used during the binge, and then just eating without biological needs. So again, it's not that they're hungry, it's just that they are kind of emotionally eating or just eating out of lack of control. So just some kind of stats here. About 4 million individuals in the United States have a binge eating disorder. About 40% are males. Again, very few in the anorexia or bulimia. Males suffer more from the binge eating. This is the most common among the severely obese that leads to that. And there is a genetic predisposition where it is, again, kind of disorders arise in individuals who are stressed by those environmental triggers or that emotional stress. So the physical effects reflect usually comorbid conditions, meaning the same thing that we talked about with obesity, like hypertension that occurs, increased cholesterol levels, cardiovascular disease, and type 2 diabetes. So again, it's pretty much the same as the obesity that we've talked about before. So treating binging, the primary goal is just to decrease and eliminate the binging. The secondary goals, though, are to lose that excess body weight, alleviate the comorbid conditions like the hypertension or cardiovascular or diabetes, and improve that psychological disturbances that typically trigger that. So then the psychological therapy, many have difficulty identifying personal emotional needs or expressing their emotions. That's why they overeat. That's how they deal with it. So that cognitive behavior can be good on one-on-one sessions, group therapy, self-help, or even web-based adaptations, mainly just, again, helping them deal in other ways with the stress or anxiety that typically leads to the binging. So some of the nutrient therapy or nutrition therapy is just learning to eat in a response to hunger. So that biological rather than emotional triggers, recording perceptions of physical hunger, learning to respond to fullness. So slowing down eating helps with that. Avoid weight loss diets. So depriving can actually trigger binge eating. So again, getting individuals with this under control as far as their triggers is important, then weight loss can occur. And then the long-term goal, though, is just to eat all foods in moderation. There are some pharmacological therapies. So in 2015, the first drug, which was the Vyvanse, was actually approved for treating binge eating disorders. So this was a stimulant that was actually used to treat ADHD. Also, antidepressants and anti-seizure medications have actually been shown to help. The orlistat can help assist with weight loss. That's the one that prevents absorption of the fatty acids. So there are some drugs that can be used more for the binge eating disorders that can be diagnosed. So then questions about the eating patterns help screen and determine which treatment is best. Right now, a few others disorders that we'll talk about. So pica is persistent eating of non-nutritive, non-food substance for at least a month. So for example, eating like clay, dirt, ice, chalk, even wood. So again, non-food products, so consuming those, this is referred to as pica. Tends to, again, co-occur with different mental disorders like autism or obsessive compulsive disorder. There are some serious health consequences due to this, due to microbial infections of eating dirt, particularly, or wood, poisoning from different toxins that they're eating of these non-food materials that can block the GI system and, of course, lead to nutritional deficiencies because they're not consuming proper amounts of food because they're consuming these non-food items. A few others. So there are some sub-threshold eating disorders, so like atypical anorexia. So this meets most of the criteria, but those whose weight is still kind of in the normal range, so they haven't fallen below, so they're close to being too thin, but they're not quite there, but they show a lot of the same symptoms. There's also sub-threshold for bulimia or binge eating, where we're getting those that occur just less than once a week. So it's occurring, but not quite to the level. So those are referred to as sub-threshold disorders. Also purging disorders. So this is repeated purge to promote weight loss, but not with the binging. So it's not bulimia because there's not the binge and then the purge. It's just purging. So this leads to body dissatisfaction, anxiety, depression. But again, the effects are the same as what we've seen from the bulimia because they're still purging, and that was the main cause of the effects, was that excessive vomiting that was seen with bulimia. And then a few others. So the night eating syndrome, so eating about 25% of our calories after an evening meal, not really feeling hungry in the morning, need to eat to help kind of fall asleep. So it's more a habit or a pattern. Waking up in the night to eat. And these behaviors produce feelings of guilt and shame. And then depression, especially at night, can lead to that. Orthorexia, this is healthful. Eating becomes an obsession. So it's not currently classified as an eating disorder, but certainly something to kind of talk about. So there are very strict rules that start to interfere with the daily life. So they're so worried about eating right and eating healthy that it actually, it interferes with their normal day-to-day lives. So typically eating like low-fat, sugar-free, organic foods, but again, an obsession over them rather than just kind of a normal, healthy decision. So again, need for perfection or purity. So not a drive for thinness, so not necessarily trying to lose weight, but just, again, that kind of perfection. Again, dietary perfectionism, having everything exactly right, getting exactly all the right calories, exactly all the right nutrients. So similar to or related to obsessive compulsive disorder. Then muscle dysphoria. This is reverse anorexia. So men and some women perceive themselves as too thin. So instead of seeing themselves as overweight, they see themselves as underweight. Again, they become preoccupied with weightlifting and diet regimens trying to gain muscle. Using anabolic steroids is common. So again, this kind of crosses over into some of the other eating disorders, but avoiding that social contact and distress over appearing too thin. So again, the opposite of anorexia, so muscle dysphoria. And then eating disorders with diabetes. So disordered eatings behaviors are actually twice as common in patients with type 1 diabetes. Those are ones who can't produce insulin, typically diagnosed early in adolescence. So about 1 in 3 teens with type 1 admit to intentionally skipping doses of insulin to induce weight loss. 1 in 5 use overdoses of insulin to compensate for binge eating. And this can lead to dangerously low blood sugar levels that can lead to like eye damage, kidney and diabetic coma, or even death. And then individuals with type 2 diabetes, up to 25% of teens actually show signs of this binge eating. So how to prevent these eating disorders? So discourage restrictive dieting and skipping of meals, providing information about normal changes, especially during puberty, whenever some of these start popping up. Correct different myths about nutrition, so essentially education, understanding what is happening. Careful phrasing about any weight recommendations or comments that are made, not overemphasizing the weight on a scale, exploring or encouraging normal expression of emotions instead of stress eating or binge eating, finding other ways to express those emotions. Encouraging children to only eat whenever they're hungry, not just, oh, it's 12 o'clock, we need to eat, but waiting for those triggers that lead to eating, providing adolescents with the right amount of independence and choice, responsibility, increase their self-acceptance, enhance tolerance of diversity of body weight, so not putting pressure on our kids to look a certain way, being respectful of environments, supportive of different relationships, emphasizing that thinness is not necessarily associated with better athletic performance. So again, think about being more muscular means being typically heavier, but that can make somebody a better athlete than being thinner. And then just having support programs, looking for different screenings that are available, and encouraging individuals to attend those.